Is obesity linked to heart attack? While talking about obesity and related disorders, it is important for you to know either you are obese or not. Maybe you think of yourself as obese, but you are overweight or vice versa. So after this video, go and check out a BMI calculator by putting in just 2 easy readings of your weight and height. If the value turns out to be above 25, then you are overweight. If the answer is above 30, then you are obese. Adults who are above 50 years of age and are obese as well have a higher risk of developing cardiovascular diseases. Incidences and heart attacks are 20 to 80% more likely to occur in them as compared to normal weight individuals. The reason behind obesity being too bad is not just related to physical appearance and social stigma. Here, the important thing to know is that obesity gave birth to many other disorders. It increases the risk for a person to develop diseases. Obesity links to heart diseases. It increases the risk for a person to get a heart attack and much more. Obesity and overweight contribute to heart failure by raising the lipid levels, particularly the bad cholesterol that are LDL and triglycerides. Obese persons are at greater risk of hypertension, and thus it makes for heart muscles to contract forcefully. Obesity is also linked to the enlarged left ventricle of the heart that leads to increased indices of heart failure. As we know, high blood pressure is a leading cause of heart attacks. Obesity plays an important role in raising your blood pressure. A simple reason is that obese individuals require more blood to supply nutrients and oxygen to their bodies. It also demands more pressure in arteries for pumping the blood in circulation. In obese persons, there are always greater levels of fat deposits. These fat deposits and plaques formed of cholesterol block the inner lining of arteries and veins. Narrowed arteries will restrict the passage of blood flow. Ultimately, muscles have to push the blood by forceful contractions. This phenomenon will result in raised blood pressure and put a person at risk for a heart attack. The passage of blood through veins is restricted, blocked, or hindered. An increased heartbeat is also associated with greater body weight as the rhythmicity of the heart is affected. Our heart rate will also be disturbed. Another reason behind obesity-linked cardiovascular diseases is the inflammatory response of our body. In obese individuals, there are high levels of adipose cells throughout the body. Adipose cells provide a medium for inflammatory reactions. The inflammation triggers the formation of the plaque, or solid fat, and also clot formation. Blood clot formation is known as thrombosis, and it will block the flow of blood towards the heart, resulting in a stroke. Due to obesity, waist circumference in men and women increases, blood pressure increases, bad cholesterol, LDL, levels increase, and levels of good cholesterol, HDL, decrease. These changes in body composition will ultimately put individuals at borderline for developing heart diseases. An obese individual has to face social stigma, rejections, and pressure as well. At this point in life, individuals feel depression and stress. Depression and chronic stress, if not controlled, may result in heart attacks. These reflect through increased heartbeat, palpitations, and induced pain sometimes. People who are obese or overweight should visit fitness centers daily. Heart-healthy exercise and counseling will yield better results rather than sit and watch yourself towards destruction. Eat less fatty foods, as fat is having direct side effects through cholesterol regulation. Obese individuals have a shorter lifespan, as different diseases throughout their life surround them. We hope you are learning something new every day from our videos. If you have a question or you want us to cover a specific topic, let us know in the comment section below. You can also connect with us directly on Instagram at the Dr. Oski, or subscribe to our YouTube channel, which is www.youtube.com/Dr. Oski.